I'm just looking to kind of get some adjustments on like my back, neck, and I'm looking to improve posture.
Okay.
Which is like a big thing for me.
Tell me, do you have any discomfort in your neck?
Yes.
Okay. How often do you have it?
I would say about 2 to 3 times a week.
All right. How long has that been going on for?
A little over 2 years.
Okay. Did you have an accident or an injury that started your neck pain?
No, so I actually saw a doctor for it, and they said it was like hyperextension.
Okay.
So.
You got was there a moment that you had hyperextension, or that's what they told you?
Yeah, that's what they said. They said hyperextension, hyperflexibility.
Okay. Interesting. All right. So how about back pain? Do you have any mid-back or low back pain?
So I'd say maybe like I'm on my feet a lot because I'm a nursing student, so like clinical and stuff. I'd say like lower back pain, but it's not enough to bother me.
Okay, do you ever have any pain down your arms?
Not that I recall.
Any numbness or tingling in your fingertips?
No.
Do you have headaches ever?
Yes, I have chronic migraines.
Okay, how long have you had migraines for?
Like as long as I can remember. I want to say like around 10th, 11th grade, like when the stress kind of started going up, that's when I noticed them.
Okay. All right, that's interesting. And so since then, who have you visited for that? So
I see a neurologist once every 6 months to kind of like, just check in. I was on a preventative medication actually, but then I made some lifestyle changes. Like I started working out, I started eating better, and that honestly like really helped me. It cut them down so much. And I've also noticed for some weird reason, after I work out like my chest and shoulders, I'll usually get a migraine.
Okay.
So I feel like a lot of mine is like muscle tightness related.
All right. So when you get the headache, migraine, where on your head does it hurt? So I can tell when I'm getting it because I get like the pain in the neck, and it kind of just like slowly goes up into the back here. And then I'll also have like the tenderness in the temples and behind my eyes. Okay. All right. So do you get massages when you have the migraines ever? I have actually once. Like. How did it help? It did help. Like it was like an immediate like release of tension. Okay. Do you ever get any dizziness? Yes. You feel lightheaded? Yes. All right. Tell me about that. How often do you get lightheaded, and when does it happen? So, I mean, I definitely get that with the migraines, but like I've noticed like if I stand up too quick, or like my eyes are very sensitive to light all the time, regardless if I have a migraine. Mm-hmm. So sometimes like if I'll go from like inside my house and walk outside, it'll kind of like, just like throw me off a little bit. Gotcha. Do you ever find yourself getting lightheaded or dizzy when you're turning your head, like when you're driving or? Occasionally, yeah. Okay. Any history of smoking? No. All right. So when they diagnosed you with hyperflexibility, did they ask you about anything else? Did they have any other symptoms that they asked you about? Did they tell you about any other possible diagnosis? Did they want you to do any genetic testing for it? They gave me the x-ray, and then that's how they diagnosed it. And yeah, they just said, look into physical therapy if the problem persists. Have you ever been to a chiropractor before? No. All right, how do you feel about it? Nervous, excited, scared? I'm actually excited. Okay, good. I like trying new things, so. Okay, very good. All right, so you're in nursing school now. What kind of nurse do you want to be? So I want to go into aesthetic medicine, which is like Botox, Juvederm fillers. I want to be a nurse injector. You have to have, at minimum, your RN. I'll graduate with my BSN. Cool. I mean, neuromodulators, like they are medication. They do have adverse effects. So like they want you to have that pharmacology background. I mean, like, I'm sure you know, like, our face is full of, like, nerve endings and arteries, and if you put filler in an artery and have an occlusion, like, boom, you want to know what you have to do. Yeah. So it does require a more extensive background knowledge of anatomy and pharmacology. Cool. So estheticians cannot do Botox injections? So when you go to a salon and get a Botox injection, who's doing it? They at least have their RN, and some of them are nurse practitioners. Wow. MDs do them. Wow. Yeah. Yeah, cool. That's like, I mean, people, I feel like, think that just because it's like non-surgical per se, that it like doesn't have risks, but
There's a lot of risks.
Oh yeah, I mean it's Botox, it's botulism toxin.
Exactly.
Yeah, absolutely.
Don't get botched.
It's nerve paralysis. You don't want to mess with that. You can't play around with that.
Exactly.
Okay, cool. All right. Well, fortunately, most of the people who watch this video are age 25 to 35, so they're not looking at those kinds of things anyway. But
well, Botox is preventative. You should actually start getting it at 25. I have smile lines because I smile so much. But
yeah, absolutely. But a smiling face is, I think there's a lot of joy in seeing someone's face that has those kinds of lines.
Yeah, there is, because you kind of think about well, what did they experience to make them smile and be happy so much to have those lines.
Yeah, absolutely. I mean, the opposite is true as well, where you can see on people's faces when they've spent the majority of their life frowning.
Then you have the frown lines.
It's just constantly like this.
Exactly, and I'd rather have them this way. So.
Yeah, absolutely. Let's do an exam. Let's see what your spine says and get you adjusted, okay?
Okay.
Okay, very gentle. We're going to start with a very gentle scan. Is this the acne?
No, it's actually psoriasis. I forgot to mention that in my history.
Do you have anything else that I need to know?
No.
All right. Do you have a family history of arthritis, psoriatic arthritis?
So I don't know about psoriatic arthritis, but my mom has psoriasis.
Okay. Do you know if she has arthritis? Does she have joint pain?
No.
All right. I'm going to do a temperature exam now with the backs of my fingers.
Okay.
Okay, very symmetrical from left to right.
Awesome.
This is a postural bump right here. Over time, if you don't watch your posture, then this will develop. It doesn't usually occur until like mid-30s to late 40s. But it's all posture, and all you have to do is keep your head like there.
So does that occur from looking down at the laptop and phone and stuff? Okay.
Yes. Let's use the instrument here, Ashley. Okay, push out against my arms. Push, relax. Good.
I guess that's more tender than any other area.
Mm-hmm. Left or right?
Left.
Tender?
Yes. That area is really tender.
Right.
On the right, yeah.
Okay, I'm going to push down into your sacrum.
What?
Do you have any tension, discomfort when I push there?
No.
Okay, left side, any there?
No.
Okay, L5, do you have any discomfort here?
No.
Here?
No.
Here?
No.
Okay, nice and relaxed, gentle breathing, good. Like this, good, down. Good, left hip up, down. Still tender?
Yeah.
Is it same, better, worse?
Better.
That's good. Okay, that's a good sign that things are movable here. Things are already starting to adapt to the blocks. Tender?
Yes.
Tender?
Yeah.
Which one more, right or left, or same?
The right.
Tender?
Yeah, but not as bad as up top. That feels really funny.
Feels really what?
Funny. My spine definitely feels a lot looser.
That's good. Nice, gentle breathing. This is a gentle spinal stretch. Okay, Ashley, I found a couple of things to adjust here today.
Okay.
We're going to start off, there's some like really simple stuff here in the mid-thoracic spine. We're going to start off here, that way I can introduce you to the adjustment and you can kind of feel what it's like, and this should be easy to move. And then after that, we're going to work our way up to like, this is the primary right here, the very top of the thoracic spine, T2. All right, let's practice an adjustment first. What you're going to do is take a deep breath in through your nose and out through your mouth. And I'm going to follow your breath down like this. And at the end of your breath, we just give a little push like that, okay? We're going to go a little bit further than that, though. It'll kind of like be like down to there, okay? Mm-hmm. Okay, so let's try it out. Go ahead and take a deep breath in through your nose and out through your mouth. Go ahead and let your shoulders sink and loose.
Wow. That was a lot of cracks. Is that normal?
Yes.
Okay.
Same thing. Deep breath in through your nose, out through your mouth. Good. Okay, one more down low. This one's a little bit different. This time you're going to breathe in, and then at the top of your breath is when we push, okay?
Still in through my nose?
In through your nose, yep, and then go all the way in.
Okay.
Good. Out through your mouth. Okay. Silent, but effective. Your legs straight. Lift your right leg in the air. Good, down. Okay, relax. Left leg. Down. Here's how we adjust the low back. I'm going to bend your top leg like this. The bottom leg is straight. Go straighten that out. That's good. I'm going to scooch this forward here just a little bit. All right, this hand like that. All right, so what we're going to do for this adjustment is I'm going to bring your hip down like this, and your shoulder goes in that direction like this. And then just let this relax, loosey-goosey here, good. And then right as we get to tension, so like right about there, we're just going to push in that direction, okay? Breathe in through your nose, out through your mouth. Good, we're going to let the shoulder come up. Good, good. Then you're back.
I like the sound. Like, it's like weirdly like relaxing.
So go ahead and turn your head to the right. Back to center. Now to the left. Back to center. Nice and relaxed here. I'm going to do some range of motion. Just try to let your head down. Just let me do it. There you go. Very gentle. What I'm going to do is bring your head. All you have to do is breathe right now. Let me do all the work. You don't have to move. You don't have to help. Good, that's perfect. You're nice and relaxed. I'm going to bring your head over to like right about here. And then from here, we just push in that direction like that. Okay, Ashley?
Mm-hmm.
Good. Nice and gentle breathing. Good. Good. Let the head drop. Good.
Wow.
Mm-hmm. That was really good.
That was good.
Okay, first, I'm going to test the right side and see exactly where it needs to go, but I already found it because do you feel that right there?
Yeah.
Little bubble of fluid, swelling, edema.
That's what that is?
Yeah. So basically, all joints in the body work like pumps.
Yeah.
And if a joint is working properly, has full range of motion, then it pumps fluid in and out all day long. But if there's restricted range of motion, then it's not accessing all parts of that pump.
Okay.
And there isn't as much fluid movement.
Okay.
And so the fluid builds up on the outside of the joint. So what we're going to do is break through all of the adhesions that prevent the full range of motion and restore the pumping mechanism. So this will be gone.
Awesome.
So nice and gentle breathing. Let's see. 7, 6, 5, 4, 3, 5. Okay, gentle, relax, sinking. 5. Good. Nice and gentle here. Good. Just sinking in.
So that bubble's just gone now? Oh my God. That's so crazy. I literally have asked my doctor about that. I did you not for the past year. And she was like, oh, maybe it's just like, why can't I think of the word? A ligament. A ligament that's just like out of place, moving around. Like that's normal.
I mean, it's common, but it's not normal.
Wow. I'm sorry, I like my feet are sweaty.
Okay, nice and gentle here. Good. Okay, squeeze. Did you feel that?
Yeah.
This is an organ manipulation, okay? The organs of digestion. So we start with the ileocecal valve.
Okay.
So we start here by identifying the umbilical and then the ASIS, the front of the hip here.
Mm-hmm.
We connect these two places, and then right in the middle is the starting point from where we're looking for the ileocecal valve.
Okay.
Tender?
Yeah, a little bit.
Your food is right here, whatever you ate last. Okay, so sometimes this, when you have stress, you know how stress causes your headaches? Sometimes also it causes the autonomic nervous system, so the nervous system that controls digestion and all the other automatic functions of the body, to falter. And so digestion hinders in times of stress, which is why IBS is commonly associated with stress.
Yeah.
But you don't have IBS though, right?
No.
Yeah. But very gentle massage here is very effective, and you can do this at home too. This may help with, sometimes this helps with migraines.
Okay. I mean, now that I think about it, my migraines do they make me sick. They make me nauseous. I can't eat. So maybe it kind of has something to do with it.
Okay, so from here we find the pyloric sphincter, which is 2 inches above the umbilical. And this is clear because you don't have anything coming out of your stomach right now. Right, and so from there we do the diaphragm maneuver. So we're underneath the rib cage here. Your diaphragm moves nicely on the left side. Let me see your tongue. How much water do you drink?
Not enough.
How much sugar do you eat?
Oh, God. A lot. More than I would like to. I'm trying to actually cut back.
Okay. That's good. You know, one thing that's really effective for sugar is to just do no sugar for 2 weeks. And it really cleans out the candida. Okay, one more time around the diaphragm. Have you ever seen this adjustment before?
Never in my life. This is all new to me.
Okay, good. Do this first. Let's make sure you're nice and tight. Good. Okay, so for this adjustment, what I'm going to do is use my hands here to support your cervical spine. Your arms in a good place. The only thing that you have to do is keep your jaw, keep your teeth closed, okay? All right, so I'm going to lift like this, and we're going to pull in that direction. This is a full spine adjustment. So nice, gentle breathing in. Good, and out. One more time, one more breath in. Out.
Mm-hmm.
One of the most even pulses I've ever felt, but maybe just your spleen a little bit. How's your immune system? Do you get sick often? Do you have like reoccurring? I guess the psoriasis.
Yeah,
is part
psoriasis. Of it, it's weird. It's either like very overactive or very. I get sick a lot.
Yeah, when you have psoriasis, you don't get sick, right? Because your immune system is on.
It's overactive.
Yeah.
But then, like, there's some points where, like, when I'm not having a flare-up.
And then you get sick.
Then you get sick.
I got a cat's claw. Cat's claw is an immunomodulator. So when it's turned up, it helps turn it down. And when your immune system is low, it helps turn it up.
Okay. No.
Look at that. It's all that increased blood flow there just means that you're, see mine? Same thing.
Yeah, why is that?
It's because you are an archetype of the healer.
Okay.
Some people are just born to do, some people are born to play music, some people are born to play sports, some people are born to build buildings, some people are born to work with people in health.
I've always thought that.
Yeah.
I've always thought that was like my calling.
Yeah, I see. You knew. Yeah, that's good.
That's crazy.
Yeah. Alright, let's see. Go ahead and stand up. Take that for a test drive. Let's see how you feel. Yeah, how does it feel? How's your spine?
Like, a lot looser. I feel like I can, like, you know, move.
Yeah.
Yeah, it feels really good.
Good.
Thank you so much.
Yeah, you're welcome so much. I'm pretty sure that hump just went away.
What?
Mouth. Excuse me.